Welcome back to my YouTube channel. Today we'll be discussing the beta blockers, the types, mechanisms, uses, and contraindications. The beta blockers are a class of medication that blocks the effects of the epinephrine and non-epinephrine on the beta adrenergic receptors, which are majorly found in the heart, lungs, kidney, uterus, and blood vessels. So, the types of beta blockers and the mechanism of actions. Before we move forward with the types of the beta blockers, it might interest you to know that the beta 1 receptors are majorly found in the heart and the kidney, while the beta 2 receptors are found in the lungs and the blood vessel. Okay, so the first type is the cardioselective beta 1 blockers. This blocks the beta 1 receptors, and these beta 1 receptors are in the heart. Okay, so what is the mechanism of action? The mechanism of action of this group of drug here is that they act by reducing the heart rate, force of contraction, the cardiac output. Then on the kidney, they act by reducing the renin release from the kidney. Normally, if the blood pressure is low, renin is released, and the renin acts on the renin angiotensin aldosterone system to increase the blood pressure. So if the renin level is low, the blood pressure goes down. Okay, so the common drugs here are the Atenolol, Metoprolol, Propranolol. If you need a mnemonics to remember the groups of drugs here, you can use a beam of Cardioselective. A beam of Cardioselective. The A stands for Atenolol, the B stands for Propranolol, the E stands for USMLE, the A stands for Carvedilol, then the M stands for Metoprolol. Then under the non-selective, blocks the beta 1 and beta 2 receptors. And I told you that the beta 2 receptors are found in the lungs and also in the blood vessels. Okay, and what this group of drugs do is that they act by reducing the bronchodilation. Okay, they reduce bronchodilation, reduce vasodilation, also reduce glucogenolysis and gluconeogenesis. Yeah, and what it means is that they can mask hypoglycemia, they can cause bronchoconstriction, and also they can cause vasoconstrictions. And the groups of drug here are the Propranolol, Atenolol, Nadolol, and Pindolol. And the contraindication here is that since this group of beta blockers cause bronchoconstriction, what it means is that do not give this group of drugs to a patient who has asthma. Do not, because it's going to worsen the asthma. And if the patient has is diabetic, do not give this class of drug because it's going to worsen it. Okay, then here we have the mixed acts on the alpha and beta receptors. Okay, and it blocks the beta 1, beta 2, and alpha receptors. And the group of drugs here are the Labetalol, Carvedilol,